Hi, my name is Shannon Wells, and I'm a physical therapist at the University of Utah, and I'm here today to talk about the role of physical therapy in movement and chronic disease management. Today, we're going to talk about the benefits of exercise, including the current exercise recommendations. And I'm hoping by the end you'll understand the role of physical therapists as exercise providers. I'll also be sharing some insights and strategies for facilitating exercise and wellness in a chronic disease population. So, physical activity and movement are important to this is not news to anyone listening today. On the left side of your screen is an infographic from the UK Chief Medical Office. The information coming out of the CDC and DHHS is very similar. I just like that this infographic includes all the information I want to talk about today. So if you look at the green section of that chart, you can see recommendations for aerobic exercise. It's recommended that adults age 18 and older have 150 minutes at least of moderate intensity aerobic exercise per week, or at least 75 minutes of vigorous intensity exercise per week. Intensity can be measured by heart rate, percentage of heart rate max, or an easier way is to use something called the talk test. At a moderate intensity of aerobic exercise, your breathing rate will be increased, but you're able to carry on a conversation. At a more vigorous intensity level, breathing rate will be elevated enough that it's hard to get more than a couple words out at a time. In addition, experts recommend strength training at 2 days a week. And for our individuals who are over the age of 65, an additional 2 days of balance training is effective for helping to prevent falls. Individuals who meet these exercise recommendations show decreased rates of chronic disease, including type 2 diabetes, cardiovascular disease. There's a decreased rate of falls in this population. Joint impact and back pain is lessened, and the rate of colon and breast cancer is lower. The benefits of exercise and resistance training in type 2 diabetes is shown in the infographic on the right. And I would argue that these benefits are not just specific to type 2 diabetics, but it can be extrapolated to the general population. And you can see that exercise benefits multiple body systems. So how are we doing in maintaining activity? You, this graph is from a 2023 cross-sectional study looking at the prevalence of sufficient physical activity among general adult population and subpopulations with chronic disease or disability in the US. The gray area of the graph represents the percentage of these populations who were not meeting those exercise recommendations, so the more sedentary section. So for a general population, 55% were not meeting those recommendations. The blue section is individuals that met the recommendations, and green is those that exceeded recommendations. So you can see for chronic disease, for diabetes, hypertension, and individuals with cancer, the rates of individuals meeting recommendation was actually, or not meeting recommendation was higher, so they're more sedentary. And then individuals with disability, which is people were classified as having disability if they answered yes to one of the following questions. Individuals having severe difficulty hearing, seeing even when wearing glasses, concentrating, remembering, or making decisions, walking or climbing stairs, dressing or bathing, or doing errands alone. So that rate of individuals not meeting recommendation was about 67% in those who described themselves as having a disability. So I would say that we need to work really hard at increasing activity in these chronic disease populations. But how can we promote physical activity? I think physical therapists can play a very center role in engaging safely and appropriately engaging patients in exercise. Oftentimes, there are modifiable barriers to starting or progressing an exercise program. For example, knee and back pain can limit participation in aerobic exercise. Patients who feel dizzy or have a history of falls are often reluctant to move. And for others, exercise can be really intimidating or uncomfortable. Physical therapists can help address these specific impairments with focused interventions and safely prescribe movement and physical activity. So I currently work at the LS Skaggs Wellness Center, which is a supervised medical gym for individuals with neurological diagnoses and chronic conditions. I see individuals who are new to our program for a full PT eval and individualized exercise prescription for use in our gym. I also do regular, usually yearly reevaluations with our participants. In my PT assessments, I do all the regular PT things. So we talk about medical history, current level of function, use of assistive devices or adaptive equipment at home and in the community. I also inquire about a patient's home environment and what assist they're getting from their caregivers. And then I'll do physical function and specific impairment testing as indicated. I also do a really large battery of functional testing, including the assessments listed on this screen here, these different outcome measures. I'm not going to go into detail about each of these tests, but together they assess balance, gait speed and endurance, lower extremity function, dual task ability, and upper extremity strength and coordination. And then after I complete this testing, I spend a decent amount of time talking to my patients about what these assessment means and what their results are with correlation to fall risk and age-matched norms as indicated. I use this information to direct my exercise prescriptions, but I also feel that it gives me an excellent objective assessment of mobility and function with measures that are validated in the literature. And many of these tests are used across the continuum of care, from acute care to home health and outpatient. So if they're within the University of Utah system, I can generally pull scores from previous settings to compare their trajectory of improvement or maybe identify areas that we need to work on. These yearly assessment points have really allowed me to adjust interventions. And then also I spend a lot of time referring patients to other specialists, potentially a Parkinson's patient whose swallow has decreased. Maybe I'm not pulling this from their outcome measure assessment, but from my yearly visits, I can send people to specialists that can really help manage their care. And overall, patients are really appreciative and engaged in this process. I have a colleague who talks about the dental model for care. Many of us go to the dentist bi-yearly, not because we have tooth pain and hopefully not because we think we have a problem, but just to catch cavities and problems with our mouth early to prevent future issues. I think a similar model could be followed with regular wellness PT visits to address impairments, especially in our patients with chronic disease or mobility limiting factors to help identify barriers or changes in their function early to help make sure that their overall independence doesn't decline. So for some, I think exercise can feel really overwhelming, especially if you're sedentary um, and you look at these recommendations and it just feels daunting. And I've also heard people call PTs pain and torture. But I like to think of exercise, especially when prescribed correctly, as hope. I work with a lot of individuals who are newly diagnosed with Parkinson's, many of which who are really concerned about their future, as Parkinson's is a neurodegenerative disease with no known cure. Medication can be really helpful for symptom management, but new research is showing that individuals with Parkinson's who complete regular to moderate intensity exercise have decreased symptom progression as compared to controls. Moderate intensity exercise is also showing promise in delaying cognitive declines, specifically in working memory, and can help to decrease agitation and other behavioral problems associated with dementia. I often talk to my caregivers who are bringing their loved ones in who have dementia or Alzheimer's, and it can be, I think, really reassuring to them that movement and uh, strength training can be beneficial not only for their loved ones' bodies, but also for their brains. Strength training can also be utilized as a means to improve function to allow increased tolerance of aerobic activities. I've seen this in practice and it can be really valuable. A previous study done in nursing homes that implemented regular strength training for its residents noticed that total daily steps in the strength training group increased, likely because they were stronger and therefore more able to get around than their non-strength training peers. So in conclusion, I would strongly advocate for physical therapists as a valuable team member to any interdisciplinary team managing individuals with chronic disease. As one of our gym members regularly tells me, you have the best job. You just get to help people feel better and make their lives better. His enthusiasm is contagious and his message is very appreciated. So here's some resources that I added. They're mostly strength training and body weight support or body weight strength training resources, along with a link to our wellness center and then one for finding PTs in your local area. Thank you so much.
Hello, I'm Emily Stone, a dietitian with UVM Osher Integrative Health, University of Vermont Medical Center, and the Comprehensive Pain Program. Today, I'll be talking about nourishment in rhythm, how the timing, balance, and rest we build into our eating patterns can restore whole person health. This is not a talk about rigid rules. It's about syncing nourishment with how our bodies are designed to thrive. I'd like you to reflect on this question. What do you wish felt different about your health? For many people, the answers sound familiar. Less fatigue, steadier mood, less pain, or simply less overwhelm around food. Evidence shows that small, consistent shifts in eating patterns, when we eat, how we balance our meals, and allowing for periods of rest can make a measurable difference in these outcomes. And that's what we're going to be exploring today. Nutrition is deeply tied to our circadian biology. Research shows that eating earlier in the day improves insulin sensitivity and helps stabilize blood sugar. Regular meals blunt the cortisol stress response, while late night eating is linked with higher inflammatory markers and cardiometabolic risk. A 2025 Frontiers in Nutrition meta-analysis found that anti-inflammatory dietary patterns reduced blood pressure, LDL cholesterol, and hemoglobin A1C. So rhythm matters, not just for energy and mood, but for measurable clinical outcomes. And I like to frame nutritional rhythm through these three anchors. Balance means a colorful, diverse plate. Plants, healthy fats, proteins, which provide fiber, polyphenols, and micronutrients that calm inflammatory pathways and support the gut immune axis. Rhythm means consistent, predictable meals that align with circadian rhythms. This supports steady energy, better hormonal regulation, and improved sleep quality. Metabolic rest refers to a gentle overnight fast, usually 12 to 14 hours, which allows insulin sensitivity to reset and activate cellular processes like autophagy, cellular repair processes. And importantly, this is restorative, not restrictive. And when I talk about balance, I mean balance in the foods we choose and in the way we build a plate. Balance also means meals with fiber, protein, and healthy fats all together. A simple guide I use is quarter, quarter, half. From macronutrient research, we know that pairing protein and fiber with carbohydrates slows digestion and prevents inflammatory spikes in blood sugar. For example, think beans with rice, with vegetables, or oatmeal topped with nuts and berries. Rhythm means when we eat matters just as much as what we eat. Our bodies have internal clocks, and feeding in rhythm with those clocks reduces stress on our system. Practical examples: eating breakfast within an hour or two of waking, make lunch the largest meal of the day, and keep dinner lighter and earlier. Even sometimes as simple as closing the kitchen by 8 helps your body rest, digest, and prepare for sleep. The third anchor is metabolic rest. Our bodies need time between meals, especially overnight, to repair and restore. One of the simplest evidence-based practices is a 12-hour overnight fast. For example, finishing dinner at 7 o'clock at night and having breakfast at 7 o'clock in the morning. During that rest, your mitochondria, the powerhouses of your cells, repair themselves. Oxidative stress is reduced and inflammatory signals quiet down. During that rest, excuse me, and rest isn't just overnight. Even pausing for a few breaths before eating shifts us into a rest or rest and digest mode, supporting better digestion and lowering inflammation. And when we apply these three anchors, food truly functions as medicine. Balanced meals stabilize glucose and energy, which translates into clearer thinking and less afternoon fatigue. And nutrition doesn't act in isolation. It complements sleep, movement, and mind-body practices. The 2025 meta-analysis confirms that dietary rhythm and anti-inflammatory patterns shift both our symptoms and the biomarkers. Food is medicine because we can see its impact on our biomarkers, as I just mentioned. For example, CRP, C-reactive protein, reflects systemic inflammation. Hemoglobin A1C tells us about blood sugar balance, and lipid profiles show us our cardiometabolic risk. Your dietary pattern can impact all of these. Anti-inflammatory foods to emphasize include our polyphenols, so all of our reds, purples, and greens, another simple guide I use. These help us manage inflammation by blocking enzymes and pathways that trigger inflammation. Fiber, all of our legumes, vegetables, whole grains, they feed gut microbiota, and in turn, those microbes create short-chain fatty acids that reduce inflammation and strengthen the gut lining, a key feature of our immune system. Healthy fats, cold water fish, nuts, seeds, plant oils, they downregulate our inflammatory cytokines. Herbs and spices, so many to list, but to name a few, turmeric with black pepper, ginger, cinnamon, cumin, and even black cumin, Nigella sativa, have strong anti-inflammatory influence. And specifically on the herbs and spices, this is the science of bioactive compounds, the natural molecules in whole foods that act directly on our body's signaling systems. So when we eat them consistently, they truly function like medicine in our bodies. So how do we bring this into everyday life? Flavor builders like herbs and spices don't just taste good. Cooking with turmeric, ginger, cinnamon, cumin, black cumin, as mentioned, add flavor and bring measurable anti-inflammatory benefits. Batch cooking and meal prep reduce stress and make consistency more likely. Soups, vegetarian chili, roasted sheet pan vegetables, or entire roasted sheet pan meals, these make for healthy foods, the easy foods to choose during the week. Eating earlier in the day leverages our circadian alignment and supports circadian health and sleep. A mindful pause, just 3 slow breaths before eating, calms the nervous system and improves digestion. And these strategies are simple and doable. They make eating in rhythm feel less like a chore and more like a form of self-care. To name a few, I've listed here on the next few slides some foods that people are interested in knowing what to do with them in the kitchen outside of maybe their more traditional uses. Turmeric is one that gets a lot of attention. I will say the thing that is most impactful for consuming turmeric and wanting to get that anti-inflammatory benefit is to eat it daily for a consistent effect on our inflammatory systems. And that is any amount, not a specific amount, but the consistent daily intake is more impactful for overall absorption. So we could have it as a typical curry, but we could also include it in our salad dressings, in our soups. We can include it into the water when we're boiling, when we're cooking our whole grains like quinoa. We can include it in our baked goods, even on our, Sunday morning baked goods like our pancakes, including it as part of our roasted vegetables. Green tea, most famous for its ECGC content. A piece that I like to mention for people that however we use it, the recommended steep time is just 1 to 2 minutes to get those beneficial polyphenols. And we could have just a cup of green tea, but we could also we could use that brewed tea in our smoothies, as part of a soup, as part of a marinade, anywhere else that we might use water in a recipe. Green tea popsicles are delicious, as well as some of these other items. Pumpkin seeds, pepitas, very high in zinc, a key nutrient for our immune system, not to mention the protein content, omega-3 content, and omega-6 content. They are a true superfood. And we could consume them just as a snack, but we could also consume them on top of our salads, on top of our soups, or even in our soups. Something I like to do at home is I like to cook my seeds right alongside in the same water as my grains. So something like pumpkin seeds I could place into my pot of rice that I'm cooking. Here. However, we cannot talk about nutrition without talking about access. So many people face food insecurity, and unless we make these strategies realistic and affordable, they won't be sustainable. So this means focusing on foods that are both anti-inflammatory and accessible. Beans, lentils, oats, frozen vegetables, canned fish, whole grains. These are nutrient dense, relatively inexpensive, and available in most grocery stores. And when we integrate these resources into care and connect people to community programs like CSA shares, vouchers, or food pantries, we make the anti-inflammatory plate not just possible, but practical. However, even when food is available, cooking at home can sometimes feel overwhelming. Barriers include time, energy, skill, and even kitchen setup. This is where culinary medicine strategies make a difference. And here at the Comprehensive Pain Program where I work, we address these challenges as a team. So the dietitian, myself, I provide personalized nutrition guidance and meal planning, while occupational therapists support energy conservation, adaptive kitchen tools, and confidence building in the kitchen. Together, we find that these disciplines help people bring food as medicine into their daily life. So no longer is it an abstract idea, but as a skill set that they can practice at home. My invitation to you today is simple. You deserve to feel nourished. Rhythm isn't about perfection. It's about finding one or two gentle shifts that bring your eating patterns in sync with your body's natural rhythms. Healing starts with small steps. Try just one rhythm shift this week and notice how your body responds. And that might mean adding color to breakfast, setting a cutoff time for evening eating, or taking one mindful breath before a meal. Even these small rhythm shifts can ripple into better energy, mood, and healing. As we nourish in rhythm, let's also advocate for food security and access so every person has a chance for whole person health. Thank you.
Hello, I'm Jennifer Molano. I'm a professor of neurology and a sleep specialist at the Osher Center here at the University of Cincinnati College of Medicine. I will be talking about sleep and how it can support your health. Our questions that we will be discussing today are: what is sleep? Why do we sleep? How much sleep do we need? What happens when we don't sleep well? What causes sleep disturbances? And how can we improve our sleep? Sleep can be defined as a way for us to disengage from the environment. It's critically important for us to find that aspect of rest, so that during our wakeful hours, we're able to participate in our day and our activities and be with the people that we work with and the people that we love. Sleep is an active process that affects all of the different systems in our body, including our endocrine system, our breathing system, even our circulation, our blood pressure, and our heart rate. It even affects our GI tract, as well as other places in our body. It's important because it can help us to conserve energy. It helps us to perform well and feel better during our day. Some thoughts were that we tend to spend 15% less energy during sleep compared to quiet wakefulness. And sleep is also incredibly important for brain health. For example, it helps us pay attention to things. It helps us with our decision making. It helps us to manage and regulate our emotions. Sleep has become such an important part of sleep health that there's new data showing that sleep is important in terms of clearing toxins out of the brain, which has potential implications for conditions such as Alzheimer's disease. And sleep health, again, is incredibly important to the extent that the American Heart Association has included it as its life essential 8 to prevent cardiovascular and cerebrovascular disease. So how much sleep do we need? The National Sleep Foundation has determined sleep duration recommendations throughout the lifespan, including from infancy to those who are older adults. For adults between the ages of 18 and 64, it's recommended to get 7 to 9 hours of sleep. For those over the age of 65, 7 to 8 hours of sleep is recommended. I usually tell people in the clinic that in order to feel well rested and functioning during the day, you need to have an adequate amount of sleep as well as good quality of sleep as well. So, what happens if we don't sleep well? It can be associated with challenges with our mood. It can lead to diminished quality of life. Some conditions, including obstructive sleep apnea, for example, increases the risk for strokes and heart disease. And there's usually a bidirectional relationship between sleep and chronic disease. So sleep may affect people's ability to deal with a chronic illness. And the chronic illness, so for example, if someone has asthma or pain or mobility issues, can also affect sleep as well. And there's a high economic cost in the sense that it can be very expensive to the economy and to the world if we are having sleep difficulties. For example, there can be increased absenteeism, so people not being able to go to work because they haven't slept very well, or if they are at work, they might not be as productive. And of course, from a memory and thinking perspective, we can have fatigue, slower response time, reduced learning, reduced flexible thinking. So we're very set in our ways. We might have increased risk taking, a higher ability for us to be more irritable and challenging. It may be more challenging for us to regulate our emotions, and we may have decreased resilience as well. So what are some of the sleep disturbances that people may have? In our clinic, we tend to see people who are excessively sleepy during the day. They might have insomnia where they're having difficulty falling asleep or staying asleep at night. And sometimes people might have unusual behaviors if they're sleeping at night. They might be kicking their legs, or they might be sleepwalking or sleep talking or acting out their dreams at night. And so as a sleep specialist, one of our jobs is to figure out what are the causes for sleep issues. And a lot of times it's many different factors. This is a 5-finger approach where we take a look at all the different aspects of potential sleep disturbances. For example, does someone have a primary sleep diagnosis? If someone snores, has headaches in the morning, and sleepiness during the day, they might have obstructive sleep apnea. Or if they have an urge to move the legs at night, that's worse at rest and better with movement, they might have restless legs. Are there psychiatric or psychosocial factors that might be contributing? So for example, people with anxiety and depression might have early morning awakenings or a higher likelihood of having arousals and insomnia at night. In addition to that, there might be environmental factors that might be contributing. Noise, for example, or light can contribute as well. Medical factors, again, if pain, other medical conditions, mobility issues, are there, that can contribute to sleep And then pharmacological factors, medications. There are many medications that can affect sleep. For example, one common medication for blood pressure, as an example, beta blockers, certain beta blockers might decrease melatonin, which is important for sleep onset. And in addition to that, you might have beyond medications that make you too sleepy, pain medications, as an example. And then circadian misalignment. So this is when you have extreme night owls or extreme early birds, where the sleep schedule might be a little bit misaligned with what's expected from society. So we look at all of these different factors to determine whether or not someone is having a sleep disturbance and what the causes might be. So how do we try to support sleep health? One of the ways that we can do that is to try and reduce the noise. There's some thought out there that if you have mind noise, body noise, and bed noise, that can contribute to sleep issues. Often I see people in the clinic and they say, my mind is racing and I can't stop my mind. Or I have a lot of pain and that makes it more challenging for me to sleep at night. Or I'm looking at my devices in bed or watching TV or reading as opposed to using the bed for sleep only. And part of the goal is to try and find ways to help us to reduce the noise. And that's where a sleep specialist can help as well. Some general tips to support sleep health. We want you to have a consistent sleep schedule. The brain likes to know when it's supposed to fall asleep and when it's supposed to wake up. When someone has an irregular sleep schedule, that's very challenging for the brain to be able to figure that out. We want to treat primary sleep conditions. So again, if you snore or if you have that urge to move your legs, see a sleep specialist. Get optimal treatment for medical and psychiatric conditions. Have a good review of the medication list because again, there's a number of medications that can affect one's sleep and can also make people sleepy during the day. We also tell people to try and minimize naps. If you have to take a nap, try to limit it to less than 30 minutes a day if needed. I typically tell people in the clinic that if you're taking a nap during the day, it can potentially steal from your sleep at night. And the goal is to try and consolidate your sleep in the evening time and nighttime. We also recommend no caffeine use after 2 o'clock in the afternoon. And the reason for that is that caffeine directly weakens our signal to go to sleep at night. And it takes about 3 to 5 hours after you last consume a caffeinated beverage for half of the caffeine in that beverage to go away. So it takes a long time for it to get out of the system. And that's why we have that 2 p.m. cutoff. Avoid nicotine and alcohol before bedtime. Nicotine and tobacco tends to be activating. And alcohol may help people fall asleep, but then it can cause sleep disturbances because it wears off in the middle of the night. In addition to also worsening sleep apnea, as an example. And then you want to maintain the bedroom for nighttime activities only. I tell people, if you're lying in bed for more than 20 minutes, you're telling your brain that your bed is for something other than sleep. So we want you to go to bed only when you're sleepy. And if you're having difficulty falling asleep and staying asleep, get up, go into another room, do something that's not engaging and boring. And then you want to keep a cool, comfortable environment. That usually helps us to fall asleep as well. So for more information, and if you are looking for a sleep specialist in your area, I direct you to the American Academy of Sleep Medicine's patient education website, sleepeducation.org. It also has good general information about sleep and sleep issues and sleep health. And we also have resources through the Whole Health program. The Introduction to Recharge can give you some information with that as well. And so I thank you all very much for listening to this presentation, and I look forward to interacting with you more. Thank you so much for your time.
Movement like yoga, qigong, tai chi, when I'm able to do them is helpful. Yeah.
Incorporating yoga has been a big one when it comes to movement.
The dietitian was pivotal in a lot of ways for me.
I have let go of things that I don't miss. Dairy, I let go of eggs, I let go of the bulk of gluten.
It was difficult for me to give up, sugar, wheat, dairy, but it definitely helped.
When it comes to nutrition, I'm vegan and I follow a mostly whole food, plant-based diet.
More vegetables and think more and more about plant-based in ways that I can make dishes that are full of colors and fun to make and fun to present.
Diet has changed 100%. Even if I'm not feeling that it's working, I know that science behind that supports.
Sleep hygiene was a really important thing for me to be introduced to and guided through.
Whenever in doubt, it's best if I rest.
So those little things has such a big impact that I just feel much better when I have to face the pain.